I get some quotes here from Thich Nhat Hanh. If you followed me, you know that I'm a big fan of Thich Nhat Hanh. Back in the 90s, I read his book, many of his books, but really, really, really powerful mindfulness teacher. Here is a quote: "Breath is the bridge which connects life to consciousness, which unites your body to your thoughts. Whenever your mind becomes scattered, use your breath as the means to take hold of your mind again." Thich Nhat Hanh. So breath is the bridge which connects life to consciousness, which unites your body to your thoughts. Whenever your mind becomes scattered, use your breath as the means to take hold of your mind again. All right. You know that I'm kind of, obsessed with the breath. It is a very, very powerful practice. You should, I'd highly recommend that you develop a practice of the breath, of something of the breath, whether it's paying attention to the breath, whether it's paying attention to the sensations of the breath, whatever it might be, whether it is counting your breaths, whatever you can do, trying to find a way to develop a breath practice. I've gone into numerous research studies of different breath practices and et cetera, and also stated that the research on breath work is gonna increase quite significantly. And so today, another research article has come out, and this is the breath practice that we're gonna do. I like doing these because it gives you multiple different ways of looking at the breath. And the research is slowly showing how breath work can actually really help cognitive improvement, can help decrease, for instance, cognitive decline. One day we may actually have it as, a possible prevention or treatment for things like dementia or Alzheimer's. We'll see how the research goes on that. But the side effects of having a breath practice are pretty minimal. In fact, there might be increased sense of euphoria, joy, present moment awareness. Depending on the type of breathing practice you do, there can be some lightheadedness, for instance. So I do recommend, if you do have like a fairly intense breathing practice where you're hyperventilating or you're holding your breath for a long period of time, that you do it lying down. But my recommendation, essentially, and I've stated this numerous times, there's never really like a one size fits all. But based on the research that's coming out, it's sort of like, if there is one size fits all, what are the recommendations that I would give to people? And it's slow down your breath, take deeper breaths, breathe with your nose if you can, and extend the exhale. And there's every single one of those recommendations is tied or linked to a physiological process that occurs, mostly looking at balancing the sympathetic and parasympathetic nervous system. And so that's sort of the recommendation. And now we're probably going to get into maybe some more rapid breathing. Maybe we're going to get into some deeper, kind of some more accentuated breathing techniques, like taking much more deeper breaths, for instance, and exhales. And this research that has just come out, that was published March 20th, 2023, the title of the article is The Effect of Deep and Slow Breathing on Retention and Cognitive Function in the Elderly Population. So the effect of deep and slow breathing on retention and cognitive function in the elderly population. First author is Suha Lee. And, I hope that people, when we start, if you've been with me for a while, as we read these abstracts together, that the language in the abstract starts to actually make sense. All right, that you kind of start to hear the language that people are using to describe things, why studies are being done when they present these sorts of things. To be knowledgeable, to have that, you're gonna gain a better perspective on not only the study but the things that you're going to be reading, and also you're really going to actually be able to, I believe, accentuate your practice. You can rest, for instance, in the, wow, this is actually, not only do I possibly feel good with this practice, but neuroscience shows that this is actually happening in my brain when I'm doing this. All right, so we are actively affecting our neurochemicals, our neurotransmitters in the brain, in our body, et cetera, et cetera. All right. So the purpose of this study was to apply deep and slow breathing to the elderly, who can be classified as potential dementia patients, to confirm changes in cognitive functions of learning and memory. All right. Already, you might see how this may or may not apply to you. Not that you are a dementia patient, but in terms of just seeing, how can I maintain cognitive functioning? How can I improve cognitive functioning of, improved ability to learn and retain memories? 45 elderly subjects were randomly and evenly divided into a rest group, a before group, and an after group. Measurements of their cognitive abilities were obtained before testing, 30 minutes after learning, and 24 hours after learning. After the before testing, measurements were obtained from all three groups. The rest group and the after group conducted new cognitive skills learning, while the before group performed deep and slow breathing for 30 minutes before learning new cognitive skills. After all three groups underwent 30 minutes of learning, the after learning test was performed. Subsequently, all right, this is the abstract. So they did essentially, they had a rest group and they had a deep breathing group. Then they did some learning for 30 minutes, and then they tested them 30 minutes after the learning and then 24 hours after the learning. Okay. And what they found here is they used a two-way repeated measure analysis of variance, measured the effect of the application of deep and slow breathing in the three groups. These results demonstrated a significant interaction of time and group in all measurements of retention and attention, working memory, and spatial perception. This study confirms the benefit of deep and slow breathing as part of a dementia prevention training protocol. Whoa. Just by breathing for 30 minutes. All right. With aging, deteriorations in health functions, including physical, cognitive, and cardiopulmonary functions and social activity occur. Dementia is attracting attention as a disease to be watched most in old age. Dementia caused by aging occurs in 80 to 90% of degenerative brain diseases. Moreover, aging is associated with a general decline in various functions of the brain, such as memory, impairment, speech impairment, loss of spatiotemporal ability, and changes in personality and emotions. Approximately 15% of all cases of dementia can be fully treated through early intervention, which highlights the importance of early diagnosis and proper treatments to slow down the progression of the disease. Currently, along with technological advances, various diagnostic tests and treatment programs are being actively implemented in the field of dementia diagnosis and management. While there have been advances in diagnostic and treatment programs for dementia, including technological developments, there is a need for training programs not only for patients with dementia, but also for older adults who are at risk of developing the disease. Recently, research activities from various angles have been reported so that the elderly can correctly perform all health function promotion activities, including cognitive function and information exchange and discussion, are being conducted to maintain humane quality of life with maximum independence in the given environment by the elderly themselves. I'm skipping a paragraph. Therefore, many researchers are paying attention to the develop of cognitive training programs that can be easily followed and maintained by elderly persons. And I would actually argue anybody. They specifically sort of target this population, but to be honest with you, these breathing techniques not only help the cognitive impairment, but they can help prevention of cognitive impairment. They can also, help balance the nervous system. Among them, the most popular training technique is breathing control. Reportedly, the ability to detect space and three-dimensional movements is greatly improved with the application of deep and slow breathing. In healthy adults, the respiratory rate is defined as 16 to 18 times per minute, but many studies have recently been reported using the deep and slow breathing method, which reduces the respiratory rate to 6 to 8 times per minute to maximize respiratory muscle activation and adjust the period of exhalation and inhalation. All right, just like what we said. All right, so 6 to 8. Right? Do you remember some of the studies that we've already looked at? Most of the studies say less than 10, right? And they have optimized it where you're really looking at 6 breaths a minute. That's sort of like what they've found in the studies looking at brain sort of interactions and 6 breaths a minute, which is a 5 breath in, 5 breath out, right? So 5 seconds inhale, 5 seconds out, exhale, 5 seconds inhale, 5 seconds exhale. There is some data to suggest that the exhale, if you are feeling stressed or anxious, that you extend the exhale, and that actually even more activates the parasympathetic nervous system. All right. So that's where those numbers come. You can say, which reduces the respiratory rate to 6 to 8 times per minute. The analysis of neural signals throughout the brain during deep and slow breathing showed the same active regions of the brain during new perceptual motor skills. The activation areas were the prefrontal cortex, the postparietal cortex, the limbic system, the cerebral motor cortex, and the central sulcus. The prefrontal cortex performs thought processing and inhibition, such as perception, short-term memory, executive memory, and regularity. The peripheral system is responsible for procedural learning, skill memory, and emotion. And the posterior parietal cortex controls planned movement, spatial perception, and attention. This suggests there is a close interaction between deep and slow breathing, cognitive function performance, and task learning processes. So essentially what they're saying there is when we look at people doing slow and deep breathing, they activate the same areas of the brain that are activated when you do this processing the memory. So can we use slow breathing to activate those areas in the brain in people that have cognitive impairment, to stimulate those areas of the brain and then teach them something and see if they'll actually retain it better? All right. So what we're doing is we're trying to kind of like, again, do some sort of like, I've called it like psychic surgery here, but it's sort of like you're going in, you're doing something to activate those areas of the brain, right, that are normally activated by doing other tasks that maybe you're not doing as well. And so you kind of hijack the brain for a little bit consciously, right, by doing breathing exercises, right? And you're saying, hey, I'm going to stimulate the brain. How am I going to stimulate it? Consciously. How? By my breath. Okay. In addition, several studies have demonstrated that deep and slow breathing affects the vagus nerve excitation and improves the retention of skill learning, right? How many times have we talked about the vagus nerve and increasing parasympathetic response, right? Being the cranial nerve 10 that is activated by the parasympathetic nervous system and essentially controls the entire parasympathetic nervous system, right? We've talked about vagal tone, et cetera, et cetera. All right. And it goes into the excitation of the vagus nerve stimulates the release of neurochemicals such as acetylcholine, epinephrine, and brain-derived neurotropic factor, BDNF, which have been reported to have positive effects on neurogenesis. So making new neurons, neuroplasticity, the ability to adapt and be malleable, and neuronal repair. Right? I can guarantee you almost every single one of us would want neurogenesis, neuroplasticity, and increased ability for neuronal repair. All right? I don't care what you do. That means that a simple breathing method can quickly promote the recovery of skills lost due to brain disease or neurological problems and can be expected to be clinically useful for improving cognitive function, performance, and tasks or skills of learning. All right? So they then go, you can read it. I put the link in the chat. It's called The Effect of Deep and Slow Breathing on Retention and Cognitive Function in the Elderly Population. So, well, what's the next question, right? What's the next most obvious question? Okay. So, and this is where you gotta be careful with research studies, right? You've got to look at the nitty gritty. You've got to look at the details, the methods, et cetera, et cetera. All right. So the question that you should all be asking yourselves is, well, what is their deep and slow breathing technique? Right? What did they actually study? What did they actually tell the participants to do that were in the deep and slow breathing group? Right? That's a good question to ask. Okay, and here's why I bring this up, because this happens frequently. Because if I was to poll everybody here, you would say, well, they just instructed the people to breathe deep and slowly to about 6 to 8 breaths a minute. Right? Wouldn't that make sense? That would make sense. That would make sense to me. Okay. So, for the deep and slow breathing group, a method was selected and performed 6 to 8 times per minute for 30 minutes. All right. So first of all, right, there's also this time factor. Right. So they did the practice for 30 minutes. Okay. So imagine doing this practice for 30 minutes. Okay. Now, if you're so busy that you can't do the practice, I've always said 5 minutes. Right? And we've actually looked at past research. We've looked at specific research that has confirmed that states, look, the minimum to do really is 5. The absolute minimum is 2. I'm getting slim here with time. The absolute minimum is 2. 5 is where I put it at. All right. They did 30 minutes. Okay. So imagine doing this practice for 30 minutes. All right. They do a 2-2-4 breathing cycle. 2-2-4. Okay. So 2-2-4. We've talked about this in the past. Right. So there's 4 parts of a breathing cycle. Okay. Usually it starts with the inhale. So usually it starts with the inhale. So there's an inhale. Then there's a pause, right? There's a break between the inhale and there's a period of time. And then there's the exhale. And then there's another pause. There's a transition, right? So it's inhale, transition, exhale, transition, inhale, transition, exhale, transition. And we've done practices here where we've done different times, right? So if you imagine, right? So if somebody says I'm doing a 5-5 breath, what they're telling you is they don't have any transitions. They're doing 5 seconds inhale and 5 seconds exhale. So they're going directly from a 5 seconds inhale, 5 seconds exhale, right? But however you put those numbers, that's kind of you'll see this coming up. Right, there's like some fairly famous like box breathing or something like that. They do 6-6-6-6, What that means is 6 seconds inhale, 6 seconds hold, 6 seconds exhale, 6 seconds hold. It's called box breathing. You can look it up, right? But the box is essentially the length of the side is, they're all the same. So it's a box. If you have a rectangle, then one side is going to be longer than the other, right? So they do what's called a 2-2-4. Okay. So the right, and I'm trying to figure out. All right. So the right nostril is covered. The subjects inhale using the left nostril for 2 seconds. They hold their breath for 2 seconds. Then they close their left nostril and exhale using their right nostril for 4 seconds. Okay. So I laugh. I sort of chuckle here, right? Because now you're introducing alternate nostril breathing into this, and it hasn't even been mentioned. Okay. And we know, right? I believe it was actually Hillary Clinton who made alternate nostril breathing popular in the United States. I believe it was. It was always popular amongst the, I call them, what do we call them? Hooligans? No, what was it? Bohemians. It was always popular amongst the Bohemians, alternate nostril breathing. But, I think Hillary Clinton made it like, I think she said like when she got stressed or something like that during the presidential, election, like what she did. And she said she did alternate nostril breathing or something like that. And then it became a big boom and everybody started. But this alternate nostril breathing has been practiced for a while. And we know there's benefits of alternate nostril breathing, number one. Okay. Number two, when you think about, so they inhale they inhale, pause, and exhale. All right. How long is that breath cycle? Well, it's 8. The whole breath cycle becomes 8 seconds, right? So if we take 60 seconds per minute and divide it by 8 seconds, you're getting at 7.5 breaths per minute on their. Okay, so you're about 7.5 breaths per minute. You're taking 8 seconds for your breath cycle. Okay, and they're also, right, like I mentioned in the past, and we've spoken about it here, is they're extending the exhale, right? They're doing a 2-second inhale, they're holding for 2 seconds, and then they're extending the exhale. The exhale is longer than the inhale. So the exhale is 4 seconds. All right. And now that also, we know that extending the exhale also stimulates the parasympathetic nervous system. It's going to stimulate the vagus nerve. All right. So you're going to get some probably enhanced parasympathetic activity from extending the exhale. Okay. So to me, this would be more of like slow, deep breathing with alternate nostril with extension of the exhale. Okay. But it's all brilliant in my book, right? In terms of how they described it and getting, is it deep, slow breathing? Well, I guess you're breathing a little bit deeper, you're breathing a little bit slower, whatever it might be. But to me, it actually encompasses, it sort of takes into account alternate nostril breathing. It takes into account slow breathing. I don't know how they instructed. They had a video that the people watched. So maybe during the video, they instructed them to take deeper breaths for that 2 seconds. But they're also extending the exhale. Okay. So that when you get in the nitty gritty of how they do it, right? That's how they did it. Okay. So what I'm going to do, so for our practice today, we're going to do the same thing. We're going to try it out. All right. Right nostril covered. You inhale through your left nostril. You hold your breath. You close your left nostril and you exhale through the right nostril. I'm not going to get into the left and right, why they chose that. All right. But there's a reason they chose that as well. I guarantee it's energetically. There's a reason they chose inhaling through the left and exhaling through the right. All right. So essentially, we're inhaling through our left nostril. and we are exhaling through our right nostril. Okay. Okay. So we're inhaling through our left nostril. Now, if you have any like sinusitis or you have a cold or you have, this might be a little bit more difficult, but follow with the inhale and exhale, because I'm gonna count it out for us. Okay. It's going to be inhale, 2, hold, 2, exhale, 2, 3, 4. And when you exhale, you want to take the amount of time to actually exhale. You don't want to like exhale it all and then hold your breath for additional seconds. So it's going to take a little bit of time to kind of get into it. I'm gonna lead it for 2 minutes, and then I'm gonna go quiet. Okay, which means that it should take you about 2 minutes to kind of find a rhythm that works for you. Again, if you find that one of your nostrils is plugged, do a 2-second inhale, hold for 2 seconds, and then a 4-second exhale. However you may, whether it's through your nose or through your mouth or whatever that might be. Okay, does that make sense? All right. Okay. So we'll get into our comfortable posture. Okay, and then I will go into, and I will kind of lead it'll be a little bit, it'll take maybe like 3 or 4 rounds for you to get into it. And then I will go quiet and do whatever works for you, right? So if you feel like you want to go a little longer on the inhale, do that. If you feel like you want to go a little longer on the pause, do that. If you feel like you want to go a little longer on the exhale, do that. Okay, so let's find a comfortable position. A position you will feel relaxed yet alert. Closing your eyes if you feel comfortable closing your eyes. If not, having a soft downward gaze. And taking 2 or 3 deep breaths, simply allowing your body, mind, and spirit to be here right now. Allowing any thoughts or recurring emotions, sensations, ideas, beliefs, just simply put them on a ledge for this next practice. You can pick them up as you finish if you wish. And for this practice, if you can, inhaling through your left nostril, holding and exhaling through your right nostril. Inhaling through your left nostril, holding and exhaling. I will lead you for 2 minutes based on this protocol that we just read. However, if you find it to be uncomfortable, do whatever pace works for you. All right. And we will begin. So in, 2, hold, 2, out, 2, 3, 4. 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 in, 2, hold, 2, out, 2, 3, 4, 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 in, 2, hold, 2, out, 2, 3, 4. Continue at whatever pace works for you. In through the left nostril, hold, out through the right nostril. And just noticing where your attention is. Breathing in whatever method, rhythm you choose. Now, taking 2 or 3 deep and slow breaths. Feeling your feet on the floor, your thighs on the chair, your back on whatever surface it's on. Breathing through your entire body. Opening your eyes if your eyes were closed. Reorienting yourself to your room and surroundings. Stretching or moving if you need to stretch. And just taking a moment to reflect on your breathing practice today.